Welcome to Dermatology Medical Missions and our program in Grenada, Healthy Skin Head to Toe. Dermatology Medical Missions is a not-for-profit 501c3 medical service organization with its focus primarily in the country of Grenada in the Southern Caribbean. Our aims are threefold: to provide outpatient in-clinic surgery to treat skin cancer in people who would otherwise go without care. In addition, we are launching a podiatry product specifically to address the needs of diabetic foot and wound care patients in developing nations. Our second aim is prevention through our public health program, Healthy Skin Head to Toe, which is a research-validated skin health education program based on the utilization of community health workers. And finally, our work is research validated to demonstrate the need for skin surgery in poor people of the world and to identify best practices. Our podiatry program is based on step-by-step podiatry program developed for the diabetic foot. This is a program for community health workers, and its web link is available for you to do. It was created by developing countries for the needs in developing countries. This project has been successfully implemented in the Southern Caribbean by our podiatrist colleague Simone Makani in the island of Barbados and in St. Lucia. The government of Grenada pledges to implement this in 2018. Dermatology Medical Missions, with our partners, will implement this. Our partners in this program include the Rotary Club of Boca Raton, the Rotary Club of Grenada St. Andrews, the Ministry of Health of Grenada, and Dermatology Medical Missions. The Healthy Skin Head to Toe program integrates the Healthy Skin for Everyone program, which was developed for dermatology education to prevent skin cancer, and the step-by-step podiatry program created by the International Working Group on the Diabetic Foot to train community health workers. Our planned activities for August 2018 is primarily to train 25 community health workers in Grenada to understand the podiatry challenges of diabetes, to screen patients for early signs of podiatry problems, and to equip them to be able to actually treat patients with minor podiatry procedures. This program is based on a thoroughly vetted program of the International Working Group on the Diabetic Foot and is part of a more advanced curriculum for training podiatry assistants in the developing world. Our inspiration for this work goes back 100 years to the work of Dr. Albert Schweitzer, the first Western doctor to go to the developing country to provide care. He was the inspiration for many who wanted to come and work with him in his hospital, and he encouraged us to find our own way wherever we are. Dermatology Medical Missions initially began to partner in Africa to treat the needs of people with albinism. People with albinism are born with white skin and develop early skin cancers, which are debilitating and often result in early death in people in their 20s. These skin cancers are largely preventable and easily curable if we can provide dermatologists to these people in time and to educate the mothers about proper skin care practices for their babies. The problem arose that within the different medical specialties, dermatology did not have a medical service organization. Ophthalmologists, plastic surgeons, other specialties have these programs, except for dermatology. Dermatology excels in education, outreach, teaching programs. However, no service program exists other than Dermatology Medical Missions to provide meaningful volunteer opportunities for dermatologists to provide hands-on medical and surgical care abroad. Other international volunteer organizations have not been able to provide the logistics for dermatologists to provide hands-on medical care for the needy people around the world. Dermatology Medical Missions was founded in 2011, and our main goal is to get all of the partners on board. We need our local doctors, we need cooperation of local governments, local nonprofits, and for the specific needs of dermatologists and now podiatrists, we require specialized pathology services, specialized equipment, and a continuous presence as well as the availability of specific medications that we use. Our program was incorporated in 2011. It is IRS approved as a not-for-profit 501c3 organization. It is 100% volunteer run with diverse financial support, and it is not limited to academic physicians or residents, but is open for dermatologists to participate. We are proud of the young people that we've been able to include in these programs, inspiring them to provide good work in their future career. Our focus on the needs of albinism starts with the human rights situation and the medical needs of these people. Albinism is a genetic disease with which people are born instead of having natural colored skin. For example, the child on the right here, we can see he's got white skin and yellow hair, but his mother has dark black skin. That child, at his tender young age, is already developing signs of severe sun damage and will develop skin cancers soon. The woman in the lower left field, you can see, has developed, unfortunately, skin cancers that are at a very advanced stage, despite her only being in her 20s. The skin cancer challenges of people with albinism are things that we can treat readily in the office under local anesthesia in a very safe manner. We've expanded our outreach to treat albino people in Africa with our partners over there. At present, our most successful partnership has been going since 2013 in Grenada, treating the poor people in this island nation in the Southern Caribbean. Our partners are the local dermatologists who work for the Ministry of Health, the Windward Islands Research and Education Foundation. Our activities include advanced diagnosis and management of dermatology diseases, dermatopathology services, dermatologic surgery clinics, the option of doing in-operating room surgery, and our long-term goal of securing NIH and National Cancer Institute research project funding for the research portion of our work. Our clinics work in an outpatient type setting. Our equipment we can transport with us readily, and we can treat people in office under local anesthesia safely and economically as we do this work. We do not require an operating room, which means we do not have to monopolize the very limited resources that are available in Grenada or in other countries when we go. Through our good partnerships, however, we do have available operating room facilities in the hospital if we require those for larger cases. In this example right here, this person has a large dermatofibrosarcoma protuberans, a type of skin sarcoma which will invade the muscles and the bone, which we can successfully treat under local anesthesia. These various activities of our programs in Grenada are recognized by the American Academy of Dermatology with a presidential citation. And we're now proud to announce the next phase of our program, which is to introduce podiatry care into our care. Podiatry care will involve the Rotary Clubs and the head-to-toe skin health program, which incorporates podiatry into the education curriculum of community health workers. Specifically, in August of 2018, our goal is to train 25 community health workers in Grenada to be able to understand the podiatry challenges of diabetes, to be able to screen patients for early signs of podiatry problems, and to perform minor podiatry procedures. We hope you will partner with us as we do this life-saving work. Thank you very much for your support.